The Minneapolis-St. Paul region is a healthy, prosperous place, but it's not prosperous for everyone.
Our governor has recognized the connection and said we shouldn't really have separate policies for education, housing, and health. There should be one policy, and we should work on that together.
And so that's what LISC is trying to do with this comprehensive approach is look at all these different aspects, and in places where we've helped to build the affordable housing, now we're looking at healthy food access, playgrounds, and community space, and helping with community safety initiatives so folks can feel comfortable going outside and using the sidewalks and using the parks. We're helping to build health clinics and get that access to good health care and all those things that are part of health.
One of the things that has been beneficial in being part of the Federal Reserve is being able to sit at both tables. We often get invited to the health table as well as the community development table. And the one thing I would want to tell community developers is that you're a very important player that needs to be at the table, and that your benefit to the community is also probably greater than what you realize.
I always held on to that belief that there was a role for community development to help inspire people to make healthy choices, but also really critically recognize that no matter how hard it is for you to say, I want to lose weight or I want to eat better, if you have to walk 6 miles to get a fresh tomato or your sidewalk's too narrow, it's just not fair.
What's exciting about conversations with the health sector is thinking about the innovation that we can do together. It's no longer just saying, well, community development's going to do one side of the ledger and health will do the other. I think what we're going to see is the opportunity to bridge that work and create a new way of working that either sector couldn't even anticipate. We're working in 2 important communities on the north side of Minneapolis where Heritage Park Senior Services campus is located, and we're also working on the east side of St. Paul supporting Rolling Hills and the East Side Family Clinic.
The LISC resources ignited the whole strategy that we've had as the city folks and property managers to focus on health and wellness of residents.
You know, the more that we can demonstrate these examples of these successful projects, I hope that that will mitigate the risk for people, and so that people will say, we want to build the next Rolling Hills, we want to build the next Heritage Park Senior Services Center.
So the community development sector has been in the health business, but we just didn't know it. As CDFIs, I think we can play an important role working with the healthcare system to think about how we can redirect some of the resources and strategies in organizations to kind of upstream and create important community programs, projects, strategies like Rolling Hills, East Side Family Clinic, Heritage Park Senior Services Center, examples like these that we can replicate here and around the country in working alongside the healthcare and public health systems to improve overall community population health.